My primary job is to safely take care of children who have major problems with their heart. One of my secondary jobs is to get the next generation ready to take care of children who have major problems with their heart. 3D models are all about trying to help them do that safely, learning on models instead of learning on patients. Here's an opportunity with 3D models to make the mistakes on the models, and then when you go and perform on a baby, you're an expert performer already.
Every person's disease is inherently different. So 3D printing for us gives us the real uncanny ability to design a product, design a treatment, design an approach. Typically, how would you do that? Well, you'd have to do a protocol and a trial and a study. Now we can come upstairs and get the actual information off a C-arm in the lab, print it off within several hours, and have a physician from downstairs just come up and try it.
The model I used today was a lumbosacral junction model. Anatomically, it seemed very accurate. Cannulating, putting a pedicle in, putting a screw in, felt very typical or very similar to putting it in native anatomy.
The new material, it has the better elasticity, better strength. So for the surgical procedures, the new material absolutely much better.
The good things about them, they're like quite soft, so you can manipulate them very well. You can retract and do like better exposure because they are so malleable.
The first foray we had was in device testing. We were trying to test how effectively a particular kind of tube can get up to the brain, depending on tortuosity. We designed a series of models with differing level of tortuosity from the chest all the way to the brain, and then tested the devices to see how they perform under those circumstances. Again, impossible to do in animals, impossible to do in patients, and really 3D printing makes it so easy to be able to do that in a smooth, streamlined fashion.
If you could operate on the person before you operated on them, how would that device feel? Would you use a different device? Would you not treat the patient? Would you now treat the patient differently?
There is enough complexity in disease and anatomy that I think having this readily available at hand can be very, very useful, and most importantly, provide patients a much safer means of care.